Hello, everyone, and welcome to another episode of the Outcomes Rocket here at Device Talks Boston. I am very lucky to be here with Stan Schneider from Real Time Innovations, CEO. Thank you so much for being here on the episode and for joining us. I would love if you could kick us off, let our listeners who are tuning in, just tell us about yourself, your background, your company, your team. What brings you here to the event this week?
Okay, I'll start with myself. So I did a PhD in robotics at Stanford 30 years ago or so, and I was always, back then, it's going to be the biggest industry ever in 20 years. It still feels like it's going to be the biggest industry ever in 20 years.
Yeah, true.
I call it an RSN industry real soon now. But we do see some real pickup in really three areas of robotics, and that's autonomous vehicles. Pickup meaning lots of investment, not necessarily profits, but autonomous vehicles, medical robotics, and warehousing robotics. And RTI is pretty heavily into the first two markets. Right. So that's why we're here, because this combines robotics and medicine. That's a great place to be.
Absolutely.
Thanks. As a mid-sized software company, RTI runs a smarter world. Our tagline, it's pretty good tagline. What we're really trying to do and what we've been doing since we started with all this is connect intelligent algorithms with the sensors and actuators that make the real world run.
Love that.
But we do that in lots of different places. We started out spin-off out of the Stanford Aerospace Robotics Lab doing autonomous flying things.
Oh, wow.
We've got about 100 of those now, 300 total autonomous vehicle designs.
Okay.
Everything, flying things, underwater things, surface vehicles, ground vehicles, delivery robots, forklifts.
Wow.
Almost
I'm sure
anything.
some of that's in medical as well. Are they delivering supplies, delivering equipment?
No, we don't do that. In medical, we do three things in medical, only one's relevant here. We do patient monitoring systems, usually large distributed networks. I'll talk about why that in just a second. But we do big imaging systems, CTs, PET scanners, MRI. And we do surgical robotics. We've done quite a few of them, more than 20. Most of the big ones. I don't get to talk about the big ones because big companies don't like that. But I can talk a lot about the little ones and what we do. And we also do defense systems, or 500 of those. We run Canada's air traffic control, NASA's launch control system.
Wow.
A lot of the renewable energy infrastructure for not solar so much, but wind power and especially hydropower.
Wow, amazing.
So,
you know what it makes me think of as you're saying that is that cross-industry experience adds so much value in the tech and innovation that your teams are bringing. I'm curious, of course, this event having such a healthcare lens, do you have any sort of predictions or thoughts for other areas of tech innovation robotics that will be brought into healthcare soon? Anything you want to see happen?
I do. Obviously, I'm a little bit biased by what we do.
Yeah.
So what we do is we're the nervous system for physical AI is a way to think of it. We connect algorithms to sensors and actuators. We're software, so we're really just getting all the right data to the right place at the right time.
Yeah.
The hottest thing out there right now is AI. We've been working with AI for quite a while. I actually spoke last year with NVIDIA about how they're integrating our stuff into their Holoscan product.
Yeah.
But we have a sort of new thing now. We're connecting. We have sort of our own AI. We call it Connects AI. Our product line is called Connects. It is trained up on how all these systems work. And we also have runtime AI now that you can connect up to systems and learn about them and subscribe to information.
I love that.
So fundamentally, we're connecting all these sensors and actuators and algorithms by allowing systems to do discovery and finding the data that's there, and then sort of what. So it's who, that's discovery, what is what you get.
Yeah.
So you can use it once you get it. And then we also have when, which is about timing and making sure things, especially in the real world, they have to be on time. They have to have feedback loops for all those kind of things.
Yeah.
So we make that easy.
I love that.
Sort of.
And so I'm almost hearing this element of clinical decision support or some sort of like collecting the right data at the right time, giving it to the right people when they need it.
Yeah. So clinical decision support is with the new AIs that we can help with that. Most of what we're doing today is actually running the robot.
Wow, amazing.
Taking the sensor input and making sure it goes to the right place. I did my talk today with Zimmer, who has a hard tissue orthopedic surgical system, and you have to, they're doing knee replacements. You have to be very accurate cuts. Robots can do that very well, very fast.
Yeah.
Augmenting the surgeon. We're not trying to replace the surgeon, but we're trying to make it easier.
That additional layer, especially
right. It's actually controlling the motion of the robotic system.
Wow. So essentially you and your teams are bringing the future to healthcare, like you said. But I'm curious, as you're sort of on that journey, going into healthcare, working with clinicians, working with hospital systems, I'm sure, are you experiencing any challenges, any roadblocks, things that are on your mind?
Oh, you can't be in the healthcare industry and not run into roadblocks. That's the middle name. I mean, it's just FDA certification and HIPAA and all the different kinds of things like that. We have approaches to all of those. A lot of our customers actually come to us because we have pretty significant experience helping our customers get through those kinds of certifications. We also have certifications in the aerospace industry and the automotive industry and industrial automation. They're different but the same, if that makes any sense.
It's highly regulated.
A lot of these are highly regulated. A lot of them, safety certification is various levels of carefulness, and we can provide credible artifacts and help to our customers to do that. It's not the main reason people buy our stuff, but it's the main reason when they get to where they need to go to production.
Yeah.
If you walk around the show floor here, you'll see many robotic systems, and none of them really are in production.
Yeah.
They're all in prototype stage. And prototype stage, a lot of things die in prototype stage because the difference between prototype stage and actual use in the real world and production is huge.
Yeah. So true.
And you have to be much more sophisticated, and we like to think of ourselves as a partner in helping people take their technology from prototype all the way into production.
I love that. I love that. And they're so useful now because I think there's so many gaps in healthcare, so many things that can be solved. And robotics, when applied effectively, seems like it can really address so many of those.
Yeah.
And what's your take on that, on gaps you want to solve in the future as it relates to healthcare?
Gaps in how robotics can be used?
Or we can take it more broadly.
It's going to be a long time before automated systems, AI systems can actually make care decisions.
Yeah.
The support is there. I think it's going to be much shorter time if it can make verification, checking up on what's going on to avoid mistakes. The demo I showed actually just connects an AI up to it's a patient simulator and can make suggestions if she's vital signs it doesn't like and say, well, the anesthesiologist, you should check the airway, or it actually can do some levels of diagnosis, but it's talking to the cloud offline today. We sort of need to bring that on-prem to deal with a lot of the regulatory issues. We're also working on that.
Yeah, no, that's great.
So I think there's gaps in what the systems are allowed and able to do, where the data can go and how that can work, and actually all the practical stuff with production, which is a real challenge.
Yeah,
so.
Absolutely. So it sounds like the future will have many things for us to tackle. And even on a smaller scale, I'm wondering for yourself, for your teams, we're going to be in June next week, which means we're entering the second half of the year. But for those listening in, tuning in, anything you want the audience to be aware of in terms of RTI, where you're headed, things to watch out for, things to stay tuned for from you and your teams?
Yeah, so where we're headed, we're trying to really enable intelligence. We've always done that. We have some new approaches that I think are really interesting that can make a lot of things that are hard. We've already made it pretty easy to leverage all of our experience by putting that into an AI, and now we're also making that available in other venues and runtime. It is a exciting period. I think we live in what I call the thin red line between what was all natural intelligence and where artificial intelligence is augmenting and replacing a lot of what had to be done manually before.
Yeah.
I'm not a worrier about that eliminating the use of people, because I think it will do, like back in the day a long time ago, there weren't any compilers, and compilers came along and made software development 10 times more productive.
Yeah.
Doing the same thing. I'm not even sure it's 10 times more productive. But what happened back then is to compete, you had to have 10 times more software.
Yeah.
And what's going to happen now to compete, you're going to have 10 times more intelligence, 10 times more ability to change quickly, 10 times more analytics, 10 times more all these things. And the AIs are a ways from actually being able to decide what to really do. Getting there, if you can specify it exactly, it's easy to do with an AI. Specify what you want exactly. If you don't care exactly what you want, it'll do AI. If I want to draw a picture of a zebra having lunch at that table, it would do a pretty good job. It might not be exactly what I had in mind, but that's okay.
Yeah.
But if you really do know what you want, like you want a good healthcare outcome and you want it to work at reasonable costs in all these different crazy environments, but you can't write it all down exactly, that's really hard. And starting to need to get to where we know which parts to automate and which parts not to automate, which has been the story of robotics forever.
Yeah, no, absolutely.
So I do think there's an amazing number of, for instance, surgical robotics systems being built now, hundreds of them. There's really only one that's in big production now, and that's an Intuitive's thing well before RTI existed. But there will be many more very soon, and some of them are very specialized, some of them are very generic. Need time to sort of learn what's going on. If you're a manufacturer building some kind of system, it's not a good time to think you can sit back and do it all yourself. And
those partnerships, the value of the partners might be never, from what I'm hearing you say. Yeah. And I think one of the things I love that you just said was it almost was about seeing this engine of data that exists in healthcare right now, because we've heard about for years how healthcare had so much data, but it wasn't being applied effectively to result in change. And it sounds like what you guys are bringing to market really helped to bring that continuum together.
I mean, the theme of my talk was usable data is key to usable AI. And usable data isn't as easy as it sounds. Because you got to have the right data, you got to have the right timing, which is really hard, and you got to get it to the right places. It really is a huge challenge to make it functional in the world. And then you have to have the AI working too. But without the usable data, you don't even have anything to work with.
So true.
So it's
so true.
It's definitely, it's sort of what we're trying to help the world figure out.
Love that. I always like to say on these episodes, anything you'd like to say directly to the audience in terms of where they can learn more information about you, where things you want to put on their radar. It could be, we've also had people say, I think this sort of terminology and words aren't being used enough in industry, and I want people to change how they're talking about things. But open space for you, and the floor is yours.
The audience to understand is there's a lot of new technologies in the world. Experience very much counts. It is really hard to develop the reliability and functionality that you need to be in production just from the academic research and the various prototypes out there. And we like to, RTI sort of positions ourselves as helping customers get from their ideas. We're not going to come up with the idea that you want to build, but getting that into a place where you can really take it to production and make it something real. The advent of AI is not one thing, it's thousands of things across many different areas. We are trying to help our customers navigate that and make it useful in the real world. So our tagline, TI runs a smarter world. We've been doing that for a long time. The world's getting easier to make smarter in one dimension because processes are getting fast enough to actually be useful for real-time thinking, real-time cognition they weren't able to do before. There's still a lot of challenges taking that physical AI and making it into a physical intelligent system that actually has all the data flow it needs to work and works with the people and all the regulatory challenges and implementation challenges. So
love that. That's great. And where do you want to direct folks?
Go to our booth, which is on the other side of this wall. If you're here at the show, probably not, but rti.com. We have a great URL that's easy to remember. You can go there, go to the industries page and select your industry. We have worldwide sales force. Get out and do demos. Our sales force aren't going to come and do a hard sell on you because we are very much engineering first, and we'll help you figure out where to start and maybe a way to do things better. So I'm on LinkedIn. I'm just Stan A. Schneider LinkedIn, but there's not a lot of Stan Schneiders out there in the real-time industry, so it shouldn't be hard to find me. I love to connect on LinkedIn. So
awesome. Love that. Well, thank you, Stan, so much, and really appreciated the conversation today. I thought it was great.
Yeah, thank you.
Awesome.
Really good.
Thanks.